A new wind is blowing across central Kenya, a wind of hope, empowerment and welfare for the poor and the vulnerable. WEM Integrated Health Services WEMIHS, a local non-governmental organization, started in 1998 to provide information, care and support to those infected and affected by HIV/AIDS, is touching lives in a profound way. As the director Werimu Mungai explains, what started as a part-time free training on matters HIV/AIDS was to soon snowball to a massive demand for HIV-related services.
A few ladies, let me say 2-3 founder members, came together and said, what can we do so that we can actually respond to the demand of the people to be aware about HIV and AIDS? And it was like, am I HIV positive? Do I need treatment? What can I do? Somebody calling you aside to ask you quite a number of questions, maybe because they think you are affiliated with organizations that work with HIV and AIDS.
For although HIV/AIDS hit Kenya in the early 80s, not much about the disease was known until far much later. The government led campaigns to educate the masses on the disease, mainly reached the urban areas, with the majority in rural settings remaining quite ignorant on the disease. With the scare and stigma associated with HIV/AIDS back then, many in rural areas ran to almost anyone they knew working in health-related sectors, if only to have a few of the myriad of questions answered.
That every weekend we had to do community awareness. We started mobilizing very informal gathering of people just to discuss about HIV and AIDS, to demystify some myths and to kind of raise an awareness like actually you can do something about it. It's not like you are helpless.
As fate would have it, Thika district in central Kenya, on which sits the 5th largest town in the country, was among the first heavy casualties of the disease that ravaged the area and its environs at a terrifying speed.
In the midst of everything, the demand of, are you meeting again? Can we hear more about this? Will you come to our church to talk about this? And we say we can't really continue this way. It's rolled up to a snowball we could not handle and had not planned well for. And it came to a point where people would really call us to go and address their loved ones who feared that they could be positive. Remember, we had no testing protocol. VCT was not there at all those days. There was no government response mechanism like National AIDS Control Council. The medical field did not have training, no medicine. So generally, it's like whoever knew something to talk to the community, and that's what we were.
WEMIHS founders thus opened a HIV/AIDS and Information Awareness Center and hired educators to dispense life and health skills to the many thousands of people who were turning up at their premises with an insatiable thirst for knowledge. Despite concerted efforts by the government and health-related agencies intensified to contain the scourge, a new trend was being observed. It was the poor and vulnerable who faced the highest risks of infection. Once infected, this group was the most affected due to the inability to access quality healthcare. This gave rise to WEMIHS's mission to adopt a holistic capacity-building approach and strengthen community structures that serve populations most affected by poverty and disease. Today, WEMIHS operations spreads to 3 districts in Kenya, targeting to impact 1 million people.
Family focus.
A typical day at their office will include such a meeting, where the staff engage and discuss on the best approach in impacting the communities they work with.